Bismillahirrahmanirrahim. Assalamualaikum. Viewers, in this video, we are going to discuss about dengue fever in detail. So, without wasting time, let's start. So, first of all, we should know what is basically dengue fever. So, dengue fever is a viral disease. It is caused by a virus. So, if you talk about that pathogen or virus which causes dengue fever, so the name of that causative agent is dengue virus, and that dengue virus belong to a flavivirus family, and it has four different subtypes as mentioned here: dengue virus 1, 2, 3, and 4. Then we will talk about the vectors. So, viewers, vectors are those microorganisms or living organism which carries and transmits the agents. I mean the virus which cause disease in a person from one person to another. So here in dengue fever, the vector is Aedes mosquitoes. So Aedes mosquitoes basically is a group of mosquitoes, and it consists of many species, especially Aedes aegypti. So here in dengue fever, the vector is Aedes mosquitoes, which carries and transmit the dengue virus from one person to another. Then we talk about the characteristics. I mean how they behave, where they live, and how they increase in their number. So basically, they are more active at daytime, means they bites and infects person at daytimes, and they breeds in the clean and stagnant waters, and most commonly they breeds in water tanks, oil tanks, and flower pots. Then we talk about the incubation period. So first of all, we should understand what is incubation period. So incubation period is the time period when an infected mosquito bites a person and the first symptoms appear. During this period, the virus multiply rapidly and increase in their number to cause disease. So usually the dengue fever incubation period is 4 to 10 days. And then we talk about the clinical features. Clinical feature means the symptoms which appear as a result of disease in the body, or the changes which are observed by an infected person. So here in a dengue fever, the illness began suddenly with a high fever and with the severe headache. A person's feel extreme headache just because of the immune system response to the virus. Then, along with the pain behind the eye, this is the most classical symptoms of the dengue fever, and this eye pain is become worsened with the eye movement. Then, muscle and joint pains. Many people you have maybe seen that they always said I have muscle and joint pains. So therefore, it is also called a backbone fever, along with nausea and vomiting. So viewers, now I will discuss warning signs. So these all are the warning signs. If any of these develop, then the patient should need to go to the hospital immediately, because the disease may become severe or worsen. So number one is if a patient has feeling severe abdominal pain. Number two is persistent vomiting, and number three is bleeding from gums or nose. Number four is extreme weakness or restlessness, and number five is difficulty in breathing, and number six is fluid accumulation in the chest or abdomen. And the most important thing I want to discuss with you people is that what happen in severe dengue fever. So basically, your blood vessel contains blood plus fluids. So what happened in severe dengue fever? This blood vessel become leaky, and the fluid escapes from the blood vessel to the surrounding tissue. So as a result, your blood pressure drops, and as your blood pressure drops, the patient may develop shock, which is known as dengue shock syndrome. So thank you.